Thank you for joining today's Call to Action for Faith-Based Leaders, Combat Substance Use Disorders in Your Communities. This webinar is hosted by the Office of National Drug Control Policy in collaboration with the Department of Health and Human Services Office of Faith-Based and Neighborhood Partnerships. This call will be recorded. We will begin shortly with opening remarks from White House National Drug Control Policy Director Michael Botticelli, followed by remarks from our panel. Thereafter, we will open up today's conference call to answer any critical questions you may have. To alert us that you have a question, please press #2 on your phone, and each question will be asked in the order it was received. Lastly, a very quick technical note. If you are currently unable to see the slides in their entirety, please press the Control and the -sign keys on your keyboard simultaneously to zoom out. Without further ado, I am pleased to introduce the Honorable Michael Botticelli.
Thank you. And thank you all for joining us on this call to action to reduce substance use in our communities. I want to start by thanking the Department of Health and Human Services Office of Faith-Based and Neighborhood Partnerships for joining with ONDCP in today's webinar. But I'd also like to give a special thanks to our panelists for being here today. Richard Cizik, the President for the New Evangelical Partnership for the Common Good, James Ott, Founder and Executive Director of Red Willow Counseling and Recovery, Farha Abbasi, an Assistant Professor in Michigan State University's Department of Psychiatry. I'm here today as Director of National Drug Control Policy, but I'm also here as one of the millions of Americans who are in recovery from substance use. Faith communities have played a critical role for many years in preventing substance use, treating substance use disorders, and sustaining recovery, and I can personally speak to that. My own journey to recovery had its beginnings in the basement of a church in Boston, where I found support from a 12-step program. The faith community has and continues to play a great influence on my life and my recovery, and I'll never forget this. A while back, I had the opportunity to have lunch with Pastor Cizik, and while we were talking, he told me about his struggles as a grieving parent and how he was able to turn his grief into action. Meeting people like Richard shows just how powerful a force you can be. Our discussion had a profound effect on how I approach my work and the tremendous responsibility I have in leading our country's drug policy efforts. So it is a real pleasure on a personal and professional level to speak with you today, and I am encouraged by the overwhelming interest from faith leaders across this country in addressing the opioid epidemic that is plaguing our nation. As faith leaders, you are uniquely positioned to help your communities because you, on a daily basis, provide spiritual, social, emotional assistance and guidance for the men and women struggling with substance use disorders. You often serve as first responders and early points of contact for people suffering from mental health and substance use problems. Alcoholics Anonymous, Narcotics Anonymous, and more recently programs like Celebrate Recovery have had a long history of gathering at faith-based institutions. Not only do you provide direct care, such as facilitating one-on-one recovery support programs or mentorship and counseling, you educate people on how to get the help they need, and you direct members of your congregations to a host of services for those in recovery. I've come a long way since my first 12-step meeting in a church, and in my work I've seen just how pressing the challenge of substance use has become in our communities and in our country. The numbers are really alarming. Every year, more Americans die from drug overdoses than from motor vehicle crashes, and many of those deaths involve prescription pain medications or heroin, which both belong to a class of drugs called opioids. The prescription drug and heroin overdose epidemic has taken a heartbreaking toll on individuals and their families while straining law enforcement and treatment programs. That is why reducing opioid use and its consequences is a top priority for this administration. On Tuesday, President Obama invited Kerry Dixon to join him for his final State of the Union address. The President met Kerry last October during our time at a community forum in West Virginia focused on the opioid epidemic. At that event, Kerry spoke candidly about the struggles of having an adult child with a substance use disorder. Kerry learned that substance use disorders do not discriminate, but she has turned her experience into action, speaking up for those who often feel too stigmatized or embarrassed to say anything or to take action. In his speech, President Obama channeled Kerry when he called on members of Congress in both parties to take action. He said, that despite the partisanship in Washington, he hoped the two sides, and I quote, can work together this year on some bipartisan priorities like criminal justice reform and helping people who are battling prescription drug abuse and heroin abuse. These issues are bigger than our political parties. They're about your communities, and in many cases, your families. So that is why I am encouraged by all of you today, and what I encourage all of you to do is to take action. There's a lot to be done, and we're working hard to educate prescribers, to expand prescription drug monitoring programs, to implement safe disposal programs, and to pursue smart-on-crime law enforcement efforts. And while our most recent data show that overdoses from prescription opioids are leveling off, we are facing a dramatic rise in heroin-involved overdoses. So we know that this crisis is far from over. We also know from decades of research that substance use disorders are chronic medical conditions. Addressing the disease of addiction requires a comprehensive approach involving evidence-based prevention, early intervention, treatment, and recovery support. Thanks to the Affordable Care Act, more Americans have access to treatment and recovery support for substance use disorders. But we still have work to do. Now, more than ever, we must expand services and ensure implementation of parity in coverage and treatment so that those struggling with substance use disorders can get the help they need and successfully recover. Communities of faith play a critical role in this because you provide those services, prevention, treatment, recovery supports that change people's lives. None of our efforts, however, are enough unless we fundamentally change the way we think about people with addictions. Substance use disorders affect nearly every community and family in America. Yet those trying to overcome this disease, like those with mental health disorders, are too often hidden in the shadows of shame and denial. All too often, the way we talk about people with substance use disorders or mental health disorders reinforces harmful stereotypes that can prevent people from accessing care and succeeding in recovery. Communities of faith have the potential to play a huge role in changing this. You understand substance use disorders are a disease, that treatment works, and that recovery really is possible. Your participation today speaks to your commitment to breaking the silence and stigma about addiction. As faith leaders, you inspire people daily and encourage them to seek help and care for their families and friends. The messages you tell can change the misperceptions and stereotypes about substance use disorders. They can also reveal the true consequences of drug use that sometimes are ignored. Using a public health framework as our foundation, you can help us highlight the importance of preventing drug use before it begins. You can advance reforms that address the overcriminalization, the lack of access to treatment, and the legal barriers that make it difficult for people in recovery to rebuild their lives. You can link people to treatment and recovery support services and build resilient communities, transforming and saving millions of lives. You truly are the front lines in your community, and we can't do this without you. President Obama said something near the end of his State of the Union address that really resonated with me. And he said, "Our collective future depends on your willingness to uphold your obligation as a citizen, to stand up for others, especially the weak, especially the vulnerable, knowing that each of us is only here because somebody somewhere stood up for us, to stay active in our public life so it reflects the goodness and decency and optimism that I see in the American people every single day. Thank you so much for being part of this effort to improve the future by ending substance use disorders, eliminating stigma, and helping people fully and successfully recover. Thank you very much."
Thank you, Director Botticelli. Next will be our panel. First will be Pastor Richard Cizik, President of the New Evangelical Partnership for the Common Good, followed by Mr. James Cox, Founder and Executive Director of Red Willow Counseling and Recovery, and Ms. Farha Abbasi, Assistant Professor, Michigan State University Department of Psychiatry. Richard, please go ahead.
Thank you, and welcome, everyone. It's a great pleasure to be here with the Director and my panelists. My story begins unexpectedly and tragically with the death of our son, Rajiv. It was just 2 years ago that he died of a heroin overdose. I woke up this morning, I pulled open my Bible, I looked out my window to see the sunrise, and I opened it, interestingly, to Isaiah 42:6-7, which reads, "To open eyes that are blind, free the captives, and release those who sit in darkness." It was somewhat prophetic for me, even this day, thinking about this program. And from there, I drove here from Fredericksburg, Virginia, into Washington. I stopped by to do something I don't do every day, but I went by Richie's gravesite. It reminded me as if I needed any reminding of why I'm here. I'm here because my son, who started an addiction with a simple prescription of oxycodone for a broken wrist doing skateboarding, became a heroin addict who went to treatment and received treatment and was alive and with us just 2 Christmases ago, but who was contacted on his cell phone. We weren't warned. We weren't prepared for it, by a drug dealer who sold him an overdose, and he died. Well, I have used this friendship I have with the director, thank you for that, and this event, so tragic as it has been, to take on this story that needs to be told, because evangelical Christians, as well as the entire Christian community and the other faith communities represented here today, need to get involved. So I say the thing that we must do is to see and think more clearly. We really must. In my home area, 75 young people in the last year have died of a heroin overdose. So we can go to slide number 2. 75 have died. And the question is, where is the faith community? My colleague and friend, Toby Larson, who had urged me to do one thing at the hospital with our family, put Richie's death in the obituary as the result of a heroin overdose. We took that advice. It was our own judgment as well. We're just open and honest people. We decided to put it out there. And so by that mere act, we put it out on the table to say, hey, look, this happened to us, and we're not going to dismiss it. And so my vision, you see, is to help people to see and think more clearly about this, because many people are, quite frankly, blind in their own communities. They can't even see it. And frankly, some parents, like me, were blind to my own son's addiction until he went to rehab. And then when he came back, I was in no position, understanding so little, to prevent what happened if I could have. Well, I don't rehearse the past, but I am willing to go forward and say we must take this message, no shame in seeking treatment. Richie didn't want treatment. He thought it would stigmatize him. He was uninclined, but we need to do this. We need to take the stigma away, admit the problem even in our own congregation, and become houses of hope, not judgment. It's really important. Number 2, I happen to think a vision without a strategy is a hallucination. So if you look in slide number 2 on a strategy, we must act. Because there's a wholesale societal systemic failure here to act. And congregations need to minister. You can see from the headline of a local newspaper, we decided collectively to hold the service, to mourn the victims. Imagine that. We would come forward, and the local newspaper supported us by pages, you can see. But that's what congregations can do. They can shift the focus to prevention from simply, hey, let's get tough on crime. We hear that every election year, get tough on crime. And the consequence is, frankly, not much, because we know that tough on crime and that kind of message doesn't do anything to save kids. I don't believe it does, at least. We have to advocate the distribution of naloxone. We need Good Samaritan laws. We need to support harm reduction measures. All of these, you see, are what it means as part of a strategy to care, to really care and love people. So that would be my second point. You all know about these issues probably more than I do, but this is what I've learned. And we have to take this cause very publicly to care. That's what we're supposed to be about, people as people of faith. Then finally, to boldly act. Next slide, if you wouldn't mind. To boldly act means that we have to tell the truth. If you would please, take the next slide. There we are, tactics, to act more boldly, to speak the truth with love. And I've mentioned that we must expand treatment for addicts as a priority for the church, the synagogue, the mosque. These are all things that we should do. Every great social movement, in this country, we know, I don't need to even rehearse them, have all begun by people of faith. And tragically, our own faith leaders are way too often ambivalent or ignorant and simply don't care. We must care and we must act boldly. And you see some of these actions. We happen to believe as a local task force we must be involved in eliminating mandatory minimums for drug offenses. And not least of all, finally, let me say, the Affordable Care Act is a lifeline for families with addiction problems. And just one more anecdote. My son worked faithfully despite his addiction and had an excellent performance rating, but his employer wouldn't give him health care insurance. They kept denying it, saying, oh, well, we'll give it to you, we'll give it to you. It just never happened. So first of all, that's just one reason alone why the Affordable Care Act is so important. And then people can get help for their addictions by joining. And so that's a real important point of treatment in closing. So my point is simply to say that we have to, as the faith community, live up to our rightful role in these areas of, casting a vision and employing a strategy, and lastly, acting boldly. And if you see there, that's where I was this morning at the grave site. But that's not a sad sign for me. It's a hopeful sign. You know why? Because he has become, for me, that motivation. My son Richie who was an incredible young man, a 6'7" basketball player, full of life. But he is now a motivation, and I know there are families by the millions around this country who have the same challenges as we do, and they need to be motivated and challenged. And so I just say God bless you all, and thank you for being here. Mr. Director, thank you for your leadership.
Thank you, Richard. We will now proceed to James Ott's presentation. James is the founder and executive director of Red Willow Counseling and Recovery. James, please go ahead.
Thank you very much. So my name is James Ott, and I am, as Eddie said, the founder and director of Red Willow Counseling and Recovery. But more importantly, I am a therapist and an interventionist, a family systems interventionist. And I want to start by telling a story about a colleague of mine that is a member of the Mormon faith, as I am. And he, like many people, started out with an injury that resulted in painkiller prescription, which eventually resulted in a heroin addiction. So at some point, he had been abusing heroin for about a year and a half, and he went to his bishop, which is the leader of the local congregation. And he told the bishop, look, I got to tell someone, I don't know where to go for help. I'm having a really hard time. I'm addicted to heroin. And his words to me is his bishop looked at him with this deer-in-the-headlight look and really had no idea of how to help this young man. Muttered something about praying more and reading more scriptures and sent him out the door. And the irony here is that he realized that in the area community congregation, they had this big, huge event preparing for a earthquake emergency. And the realization came to him is that his congregation, our faith here, was more equipped to deal with an earthquake emergency than to deal with a heroin addiction. The problem is heroin addiction is so much more prevalent than the existence of earthquakes. And we need to really understand how do we help people with heroin addiction and drug and alcohol addictions, because this is again, in our communities. So the first slide I want to show, please move on to the second slide, I guess. Yes. So I'm going to talk specifically about the LDS or Mormon community. And the point I want to make is that you as ministers, as members of the congregation, and as family members of your organization, I want you to be thinking about the strengths and weaknesses of your specific congregation that you're working with. And this is an example of some of the strengths and challenges of the Mormon community. One is addiction is a reflection of the person's spirituality. This is a myth that, or I should say this is a belief that a person has, that if there's an addiction problem in my family, there's something wrong with me. Also that people have felt as a parent. Mormons are very respectful and give a lot of credence to authority figures, the doctors per se, who don't really necessarily have a lot of training with addiction. There's also this need to appear to be righteous, and so to talk out about addiction could be perceived as there's something wrong with you spiritually as well. And in our specific religion, there's a huge epidemic of prescription pain medication abuse, and that is a combination of number one, we as Mormons don't look at prescription pain medication as a problem because, we would never, a lot of Mormons would never use alcohol or even drink coffee, but they abuse pain medications because it's not in what's called the word of wisdom. We also tend to be black and white. But we have a lot of strengths, too. We're very community-focused. We're very have a lot of strong family values. We are very active in our community. We go out and visit each other all the time. We go to church very frequently. We have, quite often, we go after people that aren't involved in our church and try to reactivate them and get them to join the community as well. And we're also really good at community organizing. And I think for us, again, as ministers, leaders in a faith-based setting, or even members, number one, we really need to understand the signs and symptoms of addiction. And so let's turn to the next slide here. Sometimes there's a lot of pressure being put on congregational leaders to solve all the problems. You've got to be able to be a doctor, a therapist, a drug and alcohol counselor, a spiritual leader. And so there's an understanding of you don't have to do everything. You don't have to solve all the problems, but you can reach out and get help from a lot of other people, especially in this situation, people who are experts in drug and alcohol. Knowing about the disease addiction, the signs and symptoms are very, very important. There was when I'm trying to think of the movie star that recently died, that there was this flurry of the paparazzi who were taking pictures of him dozing off in restaurants and looking at him, and it was clearly manifested that he had a problem with a pain medication, that he was abusing drugs. And yet people almost like mocked him and made fun of him for doing this. And the thought came to me as like, what would happen if this man was having a heart attack? How would we respond as the public? Wouldn't we want to swoop in and save his life? And so quite often there's almost this shame that goes on with the addiction and people with addiction, but also that applies to almost to us. Like, we shouldn't bother them, and we also may not be familiar with the signs, and so it's important for us to see the warning signs so that we can intervene. It is likely that there are a fair amount of people in a congregation who are abusing either pain medication, and they may even be taking them as prescribed that still could be abused, or that they do have a drug and alcohol problem. And so, again, we need to be aware of that. I also want to just touch on real briefly about codependency enabling, because these are dirty words. Number one is I really feel that we need to have a balance of compassion, and yet we don't protect the person against the consequences of their addictive behavior. So we show them love and support, but we want to support them getting well and not staying sick. Codependency enabling is really loving compassion in a misdirected form. I really think of if my son has a flu or some disease that takes him out of work for a month or so, he gets behind his rent, of course I'm going to swoop in and help him out with his rent and help him get back on his feet financially and let him take over. But the difficulty here is if I do that with my son, if he has a drug addiction, then that's seen as codependency enabling. And it is counterproductive to the having him get well. So I really want us to be thinking about codependency as really healthy, loving behavior just in a misdirected way. Anyway, let's turn on to my last slide here. And I just have some resources for you. There are a lot of resources out there. This is just a drop in the bucket with what is available. Again, I'm kind of foremost therapist and interventionist, and I wanted to provide some resources and be here to respond to any questions or anything. And so thank you for the opportunity to speak today.
Wonderful. Thank you, James. Next up is Dr. Farha Abbasi, Assistant Professor, Michigan State University Department of Psychiatry. Dr. Abbasi, please go ahead.
Thank you, James. So peace be with you all. It's an honor to be here with the director and my co-panelist. Let me speak from the point of view of Islam. So Islam is a religion of well-being and welfare. Well-being based on healthy individuals lead to healthy families, and healthy family leads to healthy society. So basically, the teachings of Quran and the following of Prophet tells us that any substance or any behavior that dulls your mind or defogs your brain, that takes you to a state of forgetfulness, that takes you away from your spirituality and your practice. And the goal is to get to a state of awareness. I am a psychiatrist and a practicing Muslim. So given the dual role here, I'm promoting this model of AAA, and we can go to my next slide. This is basically what I want to start doing, because what was really concerning to me when I tried to look up the substance abuse in Muslim community, nothing comes up on opiate use. And to me, that's more about silence and stigma than the fact that absence of evidence is not evidence of absence. So given that, I want to start with creating more awareness. Go to the next slide, please. So basically, the important thing, like my previous panelists talked about, is that it's very important to understand addiction as a disease and not just a behavioral inflection or a spiritual weakness. It is a hypodopaminergic state in your reward system of the brain. And dopamine is your good mood hormone. So if you do not have your good mood hormone in enough levels in your reward system, you start to crave these substances, these behaviors. And it's a more complex process where we should be using a biopsychosocial model. Next slide, please. Acceptance. So we all need to understand that, like any other religious or faith-based community, substance abuse is very much prevalent in Muslim community as well. And this is just one survey showing that 46% were using alcohol and 24 to 25% were using illicit drug use. And that to me is really concerning, that did we even talk about opiate in this survey? We can go to the next slide, please. Opiates is the new demon. As a provider, as a prescribing psychiatrist, I want to make some facts very clear here, that opiates have no role in non-malignant chronic pain. In fact, chronic use of opiates can, in fact, increase your pain perception in long term and make you dependent. And another thing which we do not talk about is the drug interaction. So you could be taking opiates and you would be prescribed other meds, something common like anxiety meds like Xanax, Ativan, Klonopin, or even using alcohol along with opiates, or smoking can bring down your respiratory drive and make it easier for you to overdose. So you might be using opiates as prescribed, But because you were using alcohol or using other meds, or even you are a COPD or a smoker, your respiratory drive can go 6 to 7 down, and a common regular opiate dose can cause overdose, causing coma and death. Please go to the next slide. And I think the biggest problem here is that when we talk about opiates, people do not put it in the illicit drug category, because most of the opiates are prescribed, and these are being prescribed for small injuries, minor surgeries, tooth extraction, and they are not being monitored. So people think I'm just using it as prescribed by my physician, but they are not understanding the dependency takes you, and then people start buying it on the street, or you go to the cheaper form, which is heroin. And that's where the problem then becomes really grave. I think imams have a very important role to play in this, and I love the idea that the Islamic centers should be houses of hopes and inclusion. And same thing I'm recommending is that the imams should be trained in substance use and treatment. They should be able to identify the systems of opiate use and its impact on physical and mental health, and they should be very open, willing, and to be able to refer for treatment. Please, next slide. So again, reiterating the key points, faith and spirituality has a protective effect against substance use, like we know from other initiatives, but it can also become a big deterrent in seeking help. Stigma, shame, and silence. I say this is a conspiracy of silence that needs to be broken. And then the other big issue is health disparities, and healthcare coverage can also be a big challenge to overcome. And thanks to, we can go to our next slide. Thanks to Affordable Care Act, which is affording you a parity between physical and mental health, and has also allotted more dollars towards substance abuse treatment, I would highly recommend that the imams should be aware of what is included in Affordable Care Act, and not imams only, but chaplains and faith leaders should become aware of what coverage Affordable Care Act is giving and encourage enrollment. There are more treatments now available in outpatient settings, and more integrated health with other healthcare programs would be promoted under Affordable Care Act. And patients will have better access to care that is more medically based and person-centered. In the end, I would like to just mention one thing. We can go to my next slide. So this was just the study. So in the end, I would like to end on one important message. Given the enormity of this challenge, we have a Muslim Mental Health Conference, which is in its 8th year. And just by meeting the panel today and being here and all the good work that the director is doing, I have decided to put a special training in my upcoming conference in March 17th. We will do a complete session on opiate use, symptoms, and treatment for imams, faith leaders, and chaplains, and I really hope that as many possible people should take advantage of that. This would be a free training offered at the 8th Muslim Mental Health Conference, and it's going to be March 17th in Dearborn, Michigan. Thank you.
I'd like to thank all of our panelists who spoke today. And just before we open it up to questions, all of our panelists talked about the role that shame and stigma play and the role that you can play, but also underscored the role that insurance and having access to coverage plays in terms of getting into care. And I just want to remind folks out there that open ends January 31st, and we'd love to encourage all to make sure that we get the message out that there are incredibly affordable products out there on the marketplace that must include a substance use disorder treatment benefit. So we know that shame and stigma plays a big role, but we also know that health coverage plays a big role as well. So anything you do to help us to remind folks that open enrollment ends on January 31st. We've already seen millions of Americans who've been able to access care and treatment because they were able to get health care through their exchanges. So thank you very much.
All right, and thank you to Dr. Abbasi for her presentation. We will now move into the question and answer session of our webinar. Now, for Director Botticelli and our panelists, we have received a number of questions from today's participants, and overwhelmingly, the top question was, what can faith leaders do to assist in this effort to combat prescription drug misuse and the rise in heroin overdoses? Can you each take a moment to address the question, and we will then proceed to open it up for questions from the audience.
I will begin, since I began first. This is Richard. Well, response. I would simply say what I've just said. It is that the role of faith community is to cast a vision. Without a vision, the people perish, the scriptures say. It's our role as faith leaders to cast that vision to see and understand addiction more clearly. Wow. We have a systemic societal failure. Mr. Director, wouldn't you agree with me?
I do.
It's a huge systemic failure in a society that has just seen it all wrong. Wow. We need to help people see more clearly what's really occurring. And then to use the instruments that we have as faith leaders, which have been so beautifully illustrated by both technicians here, faith leaders in other traditions, Muslim as well as Mormon, that your recommendations there are equally good for mine. That is, faith leaders who understand these addictions and then can refer people on and become advocates for treatment and no shame. And lastly, I would simply say, yeah, we're going to have to be a lot more bold. Frankly, the AIDS epidemic, it had victims, tens of thousands, millions internationally, of people who didn't get treatment, and they were in the streets. AIDS activists were in the streets, and I would simply say, as a bit of an activist myself, we have to be a lot bolder in our own society in pressing insurance companies, local and state governments, and our federal government to take action here. That would be my response.
So,
go ahead, Farah.
I realized I was third in line, so go ahead.
Go ahead.
Okay, so just reinforcing what's already said, I think it is in any faith community, imams or faith leaders are put on a very high pedestal. So if we look at the model of accessing care, if someone is having issues around mental health or substance abuse, the first person they go to is elderly in the family, but inevitably the next person is always the faith leader. Because it's like you mentioned that if you're having a heart attack, you can just sit there and have a heart attack even if you're praying. But if you are suffering from substance abuse or are suffering from a mental health issue, there's always this hush, this conspiracy of silence that let's not talk about it here, this is not to be dealt with. And I think this is the place to be dealing with all this. We need to hold the hand of those recovering. We need to have an openness in our Islamic centers and other places of religious and spiritual places. We need to be inclusive, and I think it all starts with the training the trainers. So like you mentioned that the imams or other faith leaders have to wear so many hats. They have to be therapists, they have to be marital counselors, they now have to be substance abuse specialists as well. So I think train the trainers. Thank you.
Okay. And then I'll just follow up with touching on some of my key points as well, that becoming informed, what is addiction, and knowing that you don't have to do it alone, and watching for warning signs. I think because addiction is so full of shame, that again, we tend to ignore the warning signs that are out there. I also want to point out that I think spirituality is such a powerful piece in the recovery process. It's not for everybody. Some people don't resonate it. But what's powerful about a spiritual recovery is that here you go from a place where you're spiritually bankrupt and void of all sense of worth, and to have a connection to a higher power or a God that tells you you are of value, you are important, and you are known to me, is an incredibly powerful antidote to the poison of addiction.
All right. Thank you to our panelists. Let us now go over to our question and answer session here for the audience. So again, to alert Director Botticelli or any of our panelists that you have a question, please press #2 on your phone, and you'll be notified once your line is unmuted. Again, that is #2 on your phone, and you will be notified once your line is unmuted. Each question will be asked in the order it was received. Please state your name and organization before each question. All right, so for the first question here, let us go to the line of Bishop Ron Allen.
Good morning from Sacramento, California. My name is Bishop Ron Allen. I am the CEO and president of the International Faith-Based Coalition. My question is, I work with the HIDA, High Intensity Drug Trafficking Area, which is part of the Office of National Drug Control Policy. How can we get, and is there available, a curriculum that we can train the trainer? If so, how soon can we have that curriculum? And is there any training that will go along with it and resources? Thank you very much.
Thank you, Bishop, for this is Michael Botticelli. So we will work with you. So let me say that we can probably help you on the curriculum end. In terms of resources, we could look at what other potentials out there. But I know that there are some curricula for different faith leaders have been put together. So we, at the end of this, will put together a resource of what we know are existing curricula for faith leaders and get that out to everybody to be able to do. I'm actually glad that you are connected with our high-intensity drug trafficking area. I think it shows what we are trying to do from a policy perspective, that we know our law enforcement plays a big role in protecting our community, in keeping drugs out of our community, but that fundamentally we need to work with all the other stakeholders in our community if we're going to make headway on the drug use problem.
Thank you, sir.
All right, for our next question, let us go to the line of Nina Henry.
Hi, thank you for taking my call. I had a question and then actually kind of an answer for the last question. My question is, in James Ott's presentation, one of the resources was the Arise Network, and I've never heard of that, so I'd like to hear a little bit more about what that is. And then an answer slightly to the last caller's question, I know that the National Council on Community Behavioral Health is developing a mental health first aid training for faith communities. It's not completed yet, but mental health first aid for adults is a really effective way to train folks to help them understand about mental health and substance use problems in their faith communities. I'm all set. Thanks.
Okay, so I'll respond just real quickly about the Arise Network. The Arise Network is a group of mental health and recovery professionals, and we help families in a long-term basis to address addiction and actually other chronic illnesses in a long-term scale. So quite often in our current mindset, we look at 30 days of treatment, maybe a little bit of outpatient or individual therapy after that, and then expect people to get better. So we're really looking at long-term care for not only individuals, but long-term care of families, giving families the resources they need, giving individuals, 12 months to 5 years. These models are incredibly effective in long-term recovery. That's what the Arise Network is, and you can look it up online.
This is Michael Botticelli. I will also mention that we'll get information out to folks as soon as they're scheduled. but our Substance Abuse and Mental Health Services Administration, which is our lead federal agency on issues around substance use and mental health, are planning to hold 10 regional meetings around the country dealing with issues around substance use, mental health, and trauma. And so we'll make sure that you get information when those regional meetings get scheduled, and we really hope that you participate.
All right, let us now go over to the line of David Boggs. David, please go ahead.
Will this webinar be available for us to have as a PowerPoint we can show our local organizations?
Yes, and I think we'll send you a link to the information after the webinar is over.
Okay, thank you very much.
All right, and let us now go over to the line of Sarah Grievous.
Hi, thank you so much. My name is Sarah Grievous from Livonia, Michigan. I appreciate you taking my call. I'm currently a student working on my master's on addiction and deception. I have helped start recovery, Celebrate Recovery programs. One of my things is I'm working on is with families, and I've always been concerned, and I'll continue to try to develop curriculum to help families, especially in the area of deception and self-deception. But my concern is, what can we do to, do preventative, before all of this is done? Can we place a more serious approach and attack to preventative measures? I find that most churches separate families, and so a more communal approach, a more multi-generation approach, to me, in my heart and soul, seems to be the brunt of the problem. And so what is it that is maybe available to start families with young children, long-term kind of procedures in effect? That's basically my question. So, and again, I appreciate all of your time in taking my call.
Sarah, this is Michael Botticelli. So let me suggest a couple of things here, and this is certainly not exhaustive here. And I think you're entirely right. Part of our work at the national level is to prevent a problem from beginning. One of the ways that we have been trying to promote this, that we know parents can be a powerful prevention tool. And part of what we have been doing in conjunction with the Substance Abuse and Mental Health Services Administration is giving parents toolkits on how to have conversations with their kids around substance use issues so that they don't start. That information in those toolkits are available on the SAMHSA website, and we'll make sure that we get the link out. There are also a wide variety of evidence-based prevention programs that are on the SAMHSA's website that we know to be effective. Through our office, we also put out community grants. They're called drug-free community grants, and they are awarded to communities, in essence, to try to do what we're doing today, and they bring together every sector of the community to help implement evidence-based prevention programs as they relate to issues in their area. So, but I'll ask my panelists here if they have any other thoughts.
As a psychiatrist, I know psychiatry is moving towards preventive measures as much. Like I talked earlier, that we need to have increase in resiliency on an individual level, family level, and community level. And the resiliency would come when we increase the protective factors and decrease the risk factors. And I think faith and spirituality can be a very strong tool in developing one's resiliency if used in a wisely way, and to use it to enhance one's strength and not turn religion into a source of your weakness, where it becomes that because of you belonging to a religious community, you are too ashamed or you are too scared. And again, that's where the responsibility of the faith leaders come in. And the more tools we give to our faith leaders, the more aware they are, I think they would be able to implement it better. Thank you. And thank you for the great work you are doing in Michigan.
You know, and I'm going to throw one thing in here. Some of the biggest prevention tools, and I think the tools on the SAMHSA site are so amazing. But if there's two things that a family can do to prevent drug abuse with their children is number one, believe it or not, have family dinner together every night, and number two, tell family stories. And there is really hard evidence. I mean, it's kind of an old wives' tale in a sense, but there is actually really strong evidence to show that families that have the dinner together have decreased drug addiction in their children. And number two, the connectedness that happens with family stories prevents high resiliency in families and as well as low risk-taking in children. And there's a lot of studies out about that as well. But, I mean, that's just kind of like almost basic common sense.
All right, let's move on to our next question. This one is from Casey Jones. Casey, your line is unmuted. Please go ahead.
I'd like to know, my name is Casey Jones, and I've been involved in Celebrate Recovery startup and facilitation, and also do outreach ministry full-time to churches and faith-based organizations. And I'd like to know what the plan is to try to bring everyone onto the same page on this issue. My observation is that organizations are tripping over each other to try to what I call suck up the county, state, and federal funds with no real collaborative vision in place to actually address the issues other than on a program basis. I'm aware of organizations that have been receiving money for 10 years or so now. And there's no discernible focus in the communities other than a bunch of programs at different levels that are here today and gone tomorrow. And the problem is that everyone talks about collaboration, but there doesn't appear to be a common vision. Therefore, it really is cooperation and coordination. And this usually is for the primary purpose of attaining more money because funders say there needs to be collaboration. But at the end of the day, what happens is that everyone goes back to doing what they're doing, working in silos. In fact, we now seem to have a trend to create new silos to end all silos, much like committees on committees. So I've never seen a program that somebody didn't like, but the question is, are we going to have community transformation rather than just a lot of programs that are getting very limited results and spending a lot of money? So I guess, again, is there a plan someplace out there that actually addresses the root causes and gets everyone on the same page? It's nice to have a lot of funding, but my observation is, and I've been in government also, is that it's not being directed well in order to come up with a holistic plan to actually address many of these issues.
This is Michael, and I'll start. And, I would say that, let me say a couple things. And first of all, kind of acknowledge that you're right. I administered state funds for a very, very long period of time and, saw the kind of stovepipe mentality here that, often we at the federal level inadvertently were not leveraging funding together to really look at a coordinated, consolidated approach. So let me start there. And I can tell you what we're trying to do at the federal level. So one is actually our job at ONDCT is to develop the National Drug Control Strategy, which actually brings together all 15 of the federal agencies who have a role to really make sure that we have a coordinated and strategic plan as it relates to dealing with the drug use and its consequences in the United States. And part of that is to make sure that we're aligning funding along those different areas. So we're trying to model, I think, what your expectation is that the community will be able to do that. I will also tell you that part of what we try to do with our federal contracts is to ensure that all of the stakeholders who need to be involved in issues are part of the process of some of the grant application processes and also in terms of program implementation. And I would agree with you, we fall short in many areas, but I think what we're trying to do through some of our contracting language is to ensure that all stakeholders have a role to play as it relates to some of these issues. And and again, I will reference our drug-free community coalitions, that we don't dictate what individual communities need to implement and do. What we do is provide funding to them, ask them to bring together all of the stakeholders in the community who each have their own perspective on this problem, and then to look at the implementation of real locally driven community-based solutions. And again, I'm sure there are many ways that we can improve that. We do try to make sure that at the federal level we have a coordinated plan that looks at the multidimensional aspects of drug use as it relates to our communities.
All right. Thank you, Director Botticelli. I know we've reached the top of the hour here. Do you still have time for a few more questions, or would you like to go ahead and close?
I think we need to close.
Sounds good. Please go ahead with any closing remarks you may have.
So I'd like to thank everybody for being on the call today. I'd like to thank our panelists who were so generous with their time and with their both professional and personal lives in terms of this issue. I do think I just want to echo a point that Richard Cizik brought up, that for many, many years I worked in the HIV/AIDS field, and I saw the pivotal role that faith communities played in reaching out, destigmatizing a highly stigmatized disease, and really embracing their community and families who are affected by this. I see tremendous work happening all across the country with faith communities on substance use issues, and just would encourage all of you, and I gauge by your interest in this that you're willing to partner around this. I want to thank you for the work you've been doing and for the work ahead. We will ensure that we get you a link to the slides that were presented, and also additional resources as we identify them. So thank you very much for your participation today.